Live? You are live, it says. All right. I'm going to do the duck method. Boy, you guys 100% correct. That was a lot easier. Way, 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 way easier than trying to go through OBS. Wow. Okay. Let's see how my sound is. All right, there's a little bit of a delay. It looks like there's probably like maybe a 3 or 5 second delay. I want to thank everybody that tried to help me earlier. Brown, I had the Melda family guy who is amazing. I'm sure I'm destroying his name, his family name, but it's Melda. I've typed it in more times. I have his last name probably memorized better than my own. We got the caffeine. I'm sorry, I'm destroying your name, but caffeine lady. Sometimes we watch her eating. Sometimes we watch her drinking coffee. Anyway, so my whole topic was all about neck and shoulder pain. And so hopefully we can get some people. I was supposed to have some friends come, some non-content creators to help flood the system so that's not only creators watching this information, it's also my fellow viewers and fellow friends. But anyways, the whole problem was initially I was using OBS, and everybody's correct. For me, I'm not smart enough to use it. It's probably that simple. Anyways, I am smart enough when it comes to this other stuff, just not technology sometimes. Sometimes I'm pretty savvy with it, but obviously it beat me this time. So let's talk about the neck and shoulder blade. So let's look at this way. I'm going to kind of put this right up on here. And this is essentially how it sits. Now you have pretend my fingers are my ribs, and they kind of come around where that shoulder blade is kind of gliding on your rib cage. As your hand comes over your head, your shoulder blade rotates and glides. And so let's pull that back just a few steps here. And so we have your collarbone, your shoulder blade, and your arm. These three joints essentially make up what we classically think is your shoulder. People just think your shoulder is the ball and socket. But in reality, these three bones have to move in certain positions and directions. Otherwise, your arm does not go over your head correctly. It's a floating joint. What that means is that literally the only spot that this kind of attaches to is in your sternum area. Other than that, this is really hanging on tendons, ligaments, soft tissue, myofascial, stuff like that to make this work. But the positive thing is it kind of moves all over the place. All right. And so you need to have that soft tissue mobility. But unfortunately, when you get active trigger points, which I talked about in my last live stream that worked a little bit better than this one initially, active trigger points are essentially, they are tissue area where the toxins, the metabolic processes kind of get stuck in the muscle bellies and they get inflamed. And next thing you know, it starts referring pain. And when you have a lot of pain along the inside of your shoulder blade or along the back side of what we call your rotator cuff, your posterior capsule in the back, any of those muscles along this whole area, if they get inflamed, they're irritated, you're not going to be able to raise this hand over your head correctly. And if you can, it's probably going to hurt a lot. So the three parts move. I showed you how the shoulder blade moves. The collarbone or the clavicle actually rotates out and up as you bring your hand over your head. And so there's some muscles along the inside of your neck that attach to this collarbone area. And if this arm ain't moving correctly, you can have a lot of pain on the inside here. And you can obviously have a lot of pain along the back side and up. I showed probably a few weeks ago a video called levator scapula. And that's essentially a muscle that attaches on the end. I'll put this guy right here on the end of the shoulder blade here. And it's a major pivot muscle. It attaches way up here on the muscles. And so if you think about it, if it sits like that, and that muscle's coming from here, goes all the way up to the sides of these bones on the side called your transverse processes, these little bumps on the side. And so if it's irritated at all, it's going to refer pain all the way into your neck and all the way down into your shoulder. So I have a whole video on that if you guys want to look at, and different treatment techniques that you can do at home. And that's my whole spiel here, is different techniques that you can do at home to hopefully reduce the pain and get you back to whatever you would like to do, instead of, unfortunately, sometimes, you know, have to go to the doctor for something that you could have fixed yourself. That being said, so that's one main muscle group that can get irritated and cause a lot of your symptoms. The next big one is essentially when people kind of sit rounded like this, there's this big muscle in the front that attaches to this bone here on the front. Now this bone, this shoulder blade is kind of weird looking, ain't it? It's got a lot of little bumps that jut out all over the place, and muscles love to hang off of them. And this one in the front in particular is called your pectoralis minor. And so this muscle in the front, if it's tight, it will pull your shoulder forwards, and lo and behold, your arm don't like to go over your head correctly if your shoulder is tilted forwards. So there's a bunch of different techniques, like good old magic roll. Hi everybody, thanks for coming back. Oh, I just looked here. Thank you everybody. Human bones. Yes, these are human bones. Yes, human bones. Hi, Milda family. Now, my live stream is not going to be fancy like yours. This gentleman and his family are beautiful people. They get a ton of people to come in a very short period of time. A lot of them are creators, not all of them, but a lot of them are. I'm hoping just to do one live stream a week, just to kind of give everybody some education, and maybe we get some creators and non-creators that kind of collaborate together. I'm hoping my type of spiel kind of brings more non-creators, so that way the creators that come in can also kind of do their little spiel at the same time. We'll see what happens. I'm going to try this for quite a while. Obviously, as you can look on my my channel and see that I'm going to do Wednesdays, usually at 6:30. Unfortunately, tonight was a big snafu. Anyways, back to the story. So first of all, yes. Oh, that's sweet of you, sir. Dana Go, thank you so much, sir. Yeah, I've been doing this for a long time. Needless to say, I'm not 25. I got, let's just say I got over 20 years of experience. So yeah, I've been doing this for quite a while. Healthy living and a little peppermint schnapps every once in a while keeps you looking young. But anyways, and so these three joints, if you have any problems with bringing your hand over your head, like any type of shoulder pain, you got to make sure, first of all, that the soft tissue is relaxed, because this is a floating joint. Any soft tissue, muscle, tendons, ligaments that are inflamed are going to give you an issue when you try and bring your arm over your head, in front of you, behind your back, pulling a seat belt, putting on a coat. If you sleep on this side, if you have it, let's say, or the other side, whatever side that you're having pain on in your neck or shoulder, if you're sleeping on that side, stop doing it immediately. There's one main muscle group. Let's see if I can find a pen here. Now, just pretend this pen is a muscle. You have one main muscle of your rotator cuff that goes all the way through. It sits in this kind of little, what we call a fossa, but you call it a groove or hole, whatever you want, but that's what the term's called. It comes all the way over and attaches to the side of the ball. And so when you fall asleep and you're leaning on that side, you're causing compression to that tendon. Now that's one component. The other component that the non-educated people would, or maybe even the educated people forgot about, is that your arm stretches out. And so that's actually causing the blood flow also to squeeze out of that tendon at the same time, and causing what we call anoxia, or the lack of blood or oxygen to that tendon, that will also give you pain. That tendon is your main rotator cuff muscle. Rotates out, and some of those muscles allow it to rotate in. There's 4 main muscles that make up your rotator cuff. Okay, and so any one of those 4, this being the one on the top, sits underneath your big meaty muscle here, your shrug muscle. Underneath that shrug muscle is this muscle that I'm talking about. If you have a rotator cuff tear, someone that knows they have a rotator cuff tear, more times than not, it's this muscle on the top. It's called the supraspinatus. Who cares, right? There's one that sits on the top, one that sits on the bottom, one that sits on the outside, attaches to the humerus, and one that sits on the inside to the ribs area and comes across to the front. That's your main rotator inwards, and these other ones on the backside rotate your arm outwards. And so if you're having any issues with these muscles at all, and they're very tiny and they're very easy to get injured, trust me, I've injured my own before and had to rehab myself. You won't be able to reach out to the side. Classically, once you start to lift your elbow out to your side, you're engaging those muscles. If you're having any type of pinchy, burning pain or anything across the neck or the back of the shoulder at all, it's probably coming from one of these rotator cuffs. Number 1, supraspinatus being the problem is probably your issue. What are some treatment techniques, you might ask? I baked you already. Oh man, I got the tube here. Thank you, sir. Oh, that's sweet. Thank you too. See, I had a few people come in. Top chat's only me now. That's all right. Maybe we get some other people coming in later. Otherwise, hope you guys will come back and look at this. I'm going to do probably about an hour tonight. It is kind of late, but needless to say, if you guys ever wanted to look into this stuff, you guys can go ahead and check this out later. Maybe some people come in later, and you guys can go ahead and click and ask them if they want to be part of your show, as they want to say, not channel anymore. You're broadcasting your show. Okay, and so we talked about those 4 main muscles that make up your rotator cuff. Now, some people argue about this, but there is a 5th fake rotator cuff, if you want to call it. It's called your long head of your bicep. Bicep meaning 2 in Latin. I'm going to get out my guns here for a second. Basically attaches down here, kind of splits into 2, runs all the way up and attaches inside your shoulder. And so it runs all the way up and attaches inside what we call your labrum. And a lot of There we go. Maybe that's part of the issue is my camera keeps it loses the signal a little bit. So I put it solid into the backside. Maybe that's part of the other issue. Who knows? Needless to say, I'm back. Sorry about that, folks. And so, like I was saying, the long head of the bicep runs all the way up and attaches to the labrum. What the heck is a labrum? Well, in the shoulder, essentially, oops, sorry about that. Essentially, you have your ball and you have your socket. Now, the labrum, without the labrum, which is this kind of ligamentous thick tissue, you really don't have a very deep socket. You have just the end of your shoulder blade here. And so that labrum is soft tissue, and it kind of makes that socket much deeper, and so the ball can kind of sit in there and kind of move around a bit. And that bicep runs all the way up and attaches to the top of that. And sometimes you can get what's called a labral tear. If you kind of lift this way, or maybe you get yanked out, or you did a pull and it was too heavy for you, you might have torn your bicep, or you might have torn the labrum. And so you can have what's called a SLAP tear, and there's different degrees of that. I won't go into detail here, but SLAP stands for superior labral anterior posterior. Basically, the top, front, and back side are probably torn, and there's degrees to that. The reality is sometimes it can heal a little bit, but a lot of times I see it, the person probably has to have surgery to repair that. But that's what I call the fifth rotator cuff muscle. There's not technically 5, there's technically 4, but if that bicep gets irritated or injured at all, you'll know it because it'll get everything else inflamed too, because it really does affect the mechanics of your overall 3 joints here. So let me just get a drink of water here for a second. I'm kind of parched. Now, when we talk about the referral pain from possibly from the neck or the shoulder area, where's the pain coming from? The one main test that we like to do in outpatient, and you might even see the physicians do this a lot, to kind of rule out where that pain's coming from. They'll go ahead and have you sit, and they will probably get behind you or to the side of you. And let's just say your pain's on the right side. What they will do is they will kind of rotate you to the side and then drop you back down. And so what they're doing there is they're actually collapsing and closing down the space where the nerves in the joint are at. And if it starts to give you a lot more pain or reproduces your symptoms, that might be a clear case of them that a lot of your symptoms are coming from your neck and not from your shoulder. It's called the Sperling sign. Now, that's the basic test and orthopedically that they can do. They can do a compression test. They can do a distraction test. They can do all 3 of those to kind of give them a decent idea. If all 3 of them are positive, giving you symptoms on that side, then it's probably what you got. But that's a basic test to kind of rule out whether it's coming from your neck, the pain is, or whether you really just have a shoulder problem. Now, if you're having numbness and tingling that's going down in your hand, you probably ain't got a shoulder problem. You probably have a neck problem. Without getting into too much detail, there is a thing called your brachial plexus nerves that come out through your collarbone, come out your neck, come down through your collarbone, then come out and spread up into the front and the back side of your arm. And anywhere along that area could give you your hand symptoms. So it could be from the neck, it could be from the shoulder area. That doctor would probably have you either get an MRI or do a nerve conduction velocity test to really kind of rule out whether is it coming from my neck or is it truly just coming from my shoulder. That's beyond this discussion, but if you go and see a doctor and they're kind of trying to figure out what's going on, they might do a couple of those tests, the compression, the distraction, Sperling sign, as well as they might send you for another test or send you to another doctor or neurologist to really figure out whether it's coming from your neck or your shoulder or not. But if you're just having a lot of neck and shoulder pain in here and no numbness or tingling, and we can go ahead and reduce some of the soft tissue pain with either the tennis ball trick that I showed you guys or the Theracane that I showed you guys in the past, icing and heating, maybe some Bengay, maybe some anti-inflammatories, depending on if the doctor would think it's appropriate or not. Those types of treatments you could probably try to see if it reduces your symptoms. Now, the reality is this. If you're just a lay person, if your symptoms seem to persist or seem to get worse, then you obviously want to follow up with your doctor. These are symptoms that I'm talking about seem to, you move your arm, you kind of have the pain, but it's not as bad. You have someone rub on it, it starts to feel a little bit better. And so these are some treatment techniques that you could do with the types of problems that I'm talking about. I'm just talking to all my friends here. All right, so I'm going to give it another 15 minutes. If I don't see anybody else come in, I'm going to go ahead and finish this up. But so we talked about the muscle groups. We talked about the neck. We talked about the mechanics of the shoulder, the basics of it, and where the muscles lie on the shoulder blade itself and on the ball and socket. How the movements, or like I said, the mechanics of the shoulder as you bring your hand over your head. Talk about if you have some tingling in the hand and stuff like that, how you want to go ahead and probably see your doctor. And there's some different techniques like this, growing the compression and distraction that they can do for you. So, and I also talked about some treatment techniques. So let's go ahead and look at the shoulder a little bit more in depth. So let's go ahead and say that you've had pain in the top of the shoulder for about 2 or 3 weeks. Maybe you did too much stuff out in the yard, and then you slept on it and aggravated it more. You put on your coat and you aggravated it more. You have to type all day and your arms are stretched out and you aggravated it even more. You want to realize that you're going to want to cut back some of that stuff, because it takes about 72 hours for the inflammatory process to start to calm down once you stop irritating that particular tissue, whether it's a tendon or a muscle belly or a conglomerate of any of those in the back there. Realizing that, you're going to want to ice it. You want to do some of these techniques that I've shown in the videos. You want to do those until that 72-hour period is kind of calmed down, because if it's inflamed and you do the Theracane or the tennis ball, you're probably going to get that thing inflamed even further. You think you're helping yourself, but you actually might be just making the process take longer and just aggravate yourself even more and more frustrated. So be mindful that you probably want to wait that sweet 72 hours, that 3-day mark, before you really start doing those types of techniques that I show you. You know, there's always something simple as magic towel that I've shown in the past, or a big thick pill, something that's fairly dense that you just want to put behind your back so you kind of stay extended. It allows the shoulders to drop down, and that naturally will go ahead and open the space between these two joints, because those muscles are coming through this joint space. And so all the stuff that we talk about in therapy is to open up that space, because that tendon, the last thing you want to do is pinch it between any of the ligaments or between these two beautiful bones here, because if you do, it's going to give you a lot of pain. Something simple as the magic towel roll. Now, ooh, that was loud. I'll bring up Big Bertha here. They look about the same size, don't they? And this might be a little bit bigger, but not by much. But this kind of gives you a nice view of this joint right here. This is called your AC joint. A is acromion, which is this weird looking bone that's part of your shoulder blade. All right. And the C is clavicle or collarbone. It's technically called your clavicle. So it's your AC joint. And a lot of times when you get older, like me, you can get some arthritis in that joint, and you can get some clicking and popping going on. And remember, that muscle's going underneath that tendon and that's in that joint and come around the other side. And so it's very easy. People always worry they get some clicking or some popping. I'm like, well, just don't make it like a guitar string where you keep strumming and clicking and clicking and clicking, because then you get the darn thing inflamed and aggravated. You don't want to do that. That's the last thing you want to do. But that AC joint can get inflamed too and give you a lot of pain along the side of the shoulder. And that's the last thing you want to do, is if this is the right side that's hurting you, is sleeping on that side and putting extra compression on that AC joint. Sometimes you can get what's called an AC separation if you fell on it or some sort of trauma, or someone yanks your arm. You can get what we call an AC separation, and there's different grades to that. And that's where you have a lot of pain there. And obviously, like I told you earlier on, when your hand comes over your head, that collarbone rotates. That means that AC joint is getting a little bit of movement in it as your collarbone rotates. And so, yeah, if you have any type of AC joint pain or arthritis in there and you raise your arm up, yeah, it's going to hurt a little bit, because that joint is rotating as your hand comes up. And so that's another spot that you can have pain. It has nothing to do with your rotator cuff, it has nothing to do with the muscles. You could just have some AC arthritis, and you might just want to try some ice, some rest, some compression, and just kind of put it maybe in a supported, unloaded position like this to give it a little bit of a break, kind of unload that joint, unload those tendons. There's a shoulder one that I did a while back, and I'm probably going to show it again this weekend. It's just a nice little taping technique that you can do to unload your AC joint, to unload that rotator cuff, and give it just 2 or 3 days of rest. You know, kind of give that shoulder the environment that it needs to help reduce that overall pain and hopefully reduce that inflammation, because that's what the name of the game is. The name of the game is to reduce the inflammation, allow the shoulder, the muscles, and the joints to heal over time and not get them aggravated. And hopefully you can, you know, luckily walk through the tea leaves and not have to go and see the doctor and they have to go through x-rays and MRIs and stuff like that. So it's all about managing your symptoms. So I want you to look at some of these videos. Now, you don't have to look through them all. I mean, I'm here as a content creator. I'd love to have you watch all my videos, obviously. I'm not making a dime off them, I'll tell you that. They're not a big dime, and that's all right. I mean, I like to make a few dollars, but the reality is I'm here to try and help people. And help people the best I possibly can. So if you want to leave some comments down below, or hit me up on my website or my YouTube channel, whatever you want to label it as, and maybe I can kind of give you some hints here and there on, you know, maybe what video you might want to look at, or you know, obviously, like I've always said, you know, this is not, you know, what you're supposed to do instead of going to the doctor. If it's bad enough, go to the doctor. This is some hints. Maybe you've gone to therapy before, and maybe this is a nice little refresher course for you. That would be kind of nice. But I did give you in one of my rotator cuff videos, you just have to look under, I think, my shoulder pain playlist. If you look under playlist, it'll be underneath there. I go over different treatment techniques to reduce pain, postural techniques, taping techniques, TENS unit, Theracane, tennis ball, icing and heating, and strengthening exercises you can do to kind of manage a little bit of this rotator cuff problem. I'm going to bring a kind of a new twist this weekend on one. Me and my boy Scully over here, we're going to be bringing you some content on Saturday. So like I always say, you know, Scully like to say, look up and keep smiling. So I want you all, thank you all for coming. Whoever came initially, I want you to thank for stopping by. It was very nice of you to come by and just to see me for a few minutes. Hopefully give me a thumbs up. If you didn't give me a thumbs up, I completely understand, because this was really a snafu. And I'm starting a new program, and so I'm hoping this next week I won't have any problems anymore. I might, you know what? I won't do that. I'm just going to bring you guys the show on Saturday, and then I'll bring you guys a new live stream next week. And maybe we'll talk about the hip a little bit. I'll leave you guys, if you're going to leave some comments of what you want me to talk about, or maybe you want me to talk about the SI joint, or even what the heck is the SI joint. So kind of, if you want to leave me some comments down below and kind of, you know, what you want me to talk to next time. Otherwise, I'll bring in another, hopefully a better, exciting content video next time. So I want to sign off now, and I want to say thank you to all my creators, as well as my my family members, my subscribers, and see you next time.